This is the first time since 1838 that we've actually had neighbours living within what were the walls of the then sanatorium.
Our hospital is based right in the middle of like quite a large expanding community. We are currently standing in Trinity building, which has been just an amazing achievement. The building itself has really lent to reducing the stigma in mental health.
We moved in on the 5th of December 2022. My first impression was wow.
I think one of my favourite moments on this project, and very much what we do at Hospital Rooms, is changing people's perceptions of what people can do in these spaces.
This project started more than 20 years ago. In terms of the healthcare estate within South West London, our programme actually makes sure that we deliver more than £500 million worth of transactions which improve our estate. That's from land transactions for land that we no longer needed, but also self-funded the great new facilities that we much needed to update and give better care to patients. We've now welcomed over 220 residential neighbours onto site. We're building out the list of the more than 1,000 homes to come forward, and it's really starting to destigmatise mental health in the heart of our community.
Historically, a lot of our buildings, our inpatient settings particularly, have been built in old, sort of old historic kind of asylum type buildings, and although we've done the best that we could do in those buildings to make them with privacy and dignity and destigmatising and making the environment kind of as best we can, they're still not ideal. So this has been just a fantastic opportunity. Having a bigger open environment for our patients has really had a significant positive impact on their well-being.
We came from a very small, tight, old building with very narrow corridors. So coming here, I felt like jumping through centuries. Facilities in our new build are really way ahead of what we've had before. The biggest change, particularly for patients, are bathrooms, ensuite facilities. It does make it much more comfortable. It's obviously important for confidentiality, dignity, privacy, and just feeling, I think, a little bit more perhaps homely, because it's a long stay ward, so we want to have some comfort. Staff are much more sort of visible with each other. The team is much easier to see. Our offices are not placed on different floors. The space is much bigger. We encourage everybody to sort of stay in big offices and mix, because we are multidisciplinary teams. We don't want to sort of have splits.
The facilities is very nice. It's colourful, it's bright, it's spacious. So our patients, they love the sensory room. And they can come in here, maybe you have like 4 or 5 of them just sat in here, and they're just sitting there, they're not even talking, but it's just a really great space for them. What I would say is, inside of their rooms, on the outside, you have the benches there. So sometimes they'll be like, oh, let's just have a one-to-one. They will come outside and then they'll just sit next to you. So we just sit there and we just discuss what is going on.
We have worked really closely with a charity called Hospital Rooms. So the artists have gone out into our services, onto our wards. They've worked with our service users to come up with some really creative and just very different pieces of art that actually you would never see anywhere else.
Hospital Rooms was founded 7 years ago by Neve White and Tim A. Shaw, after they went to see a friend of theirs at a mental health hospital. And they saw how derelict and how run down the space was, and they felt a passion, a real passion, to go out and do something about it. Co-production for us is very central to the DNA of Hospital Rooms. We bring an artist along who runs a workshop. They are able to have a conversation with these patients and be able to speak to them as they are.
What the patients have said is, part of this, they felt really included in where they were going to move to, what it was going to look like. So not just building another hospital, not just like bricks and mortar, but the feeling that this is really part of a co-production, that they've been involved from the beginning. And it's not just about, all right, we've got a nice shiny new ward. There's something about changing the culture.
Art in hospitals is so important as it engages staff and the service users to engage with themselves. A lot of these spaces are very intense, where people are dealing with their diagnosis on an everyday basis. So having the ability to go away, do an art activity, and then see their contribution in their spaces is so vital for their recovery.
Mental health, mental ill health, and the importance of mental good health is endemic within every population and community we have. What we're doing here, and this is groundbreaking for our trust, it's groundbreaking for our community, is we're normalising by having us front and centre and making sure that people aren't scared of wondering what's behind the wall. We're more than a neighbour. When you look at the requirements of the NHS long-term plan, and for organisations such as ourselves to be an anchor institution, it's really easy for some organisations to take that in a very sequential way about where we procure. It affects our carbon footprint, but here we have a unique opportunity to be so much more. We can genuinely support mental well-being by actually looking at how we can influence our communities around us. And that's everything from supporting around employment to supporting around opportunities for vocational staff, but and the value of that and the long-term sustainable part of it is in social terms so much more than we could have ever written into any of our ideas when we started this journey.